So today we will talk about the common surgical instruments. The first one is a true cut biopsy needle, and this true cut biopsy needle is used for obtaining the core tissue samples from the soft tissues like breast lump, kidney masses, lipoma, and it is done for the histopathological examination. The second one is a two-way pulley catheter, and this two-way pulley catheter is used to relieve the urinary retention, and it is also used after the transurethral resection of the bladder tumor. It is also used in prolonged comatose patient, and it is also used after the pelvic surgeries and various gynecological surgeries, and it is also used for collecting the urine output, and it is also used after the prostate surgery. And the complication of the pulley catheter is urethral rupture and the urinary tract infection. This one is a NG tube, and the nasogastric tube is used for the gastric lavage in the case of the poisoning, and this NG tube is also used for the NG aspiration in case of the intestinal obstruction, and it is also used for feeding purpose in case of unconscious patients. And the complication of the NG tube include esophageal perforation, tube blockage, and the misplacement of the tube into the trachea. This one is a three-way pulley catheter, and this three-way pulley catheter is used for irrigation of the bladder to prevent the clot formation, and it is also used for the drainage of urine, and it is also used after the prostate surgery, and it is also used after the transurethral resection of the bladder tumor. This one is a Wells clamp, and this Wells clamp is used for holding the large vessels in nephrectomy, and it is applied at the pedicle of the renal artery. This one is a sponge holding forceps, and it consists of the transverse serrations, and it is used for holding the sponge piece dip in antiseptic solution to clean the operating area. This one is a proctoscope, and the proctoscope is used both for diagnostic purposes and therapeutic purposes. So the proctoscope is used for the diagnosis of the rectal polyps, hemorrhoids, and any tumor in the rectum, and it is also used in the polypectomy, and to it we also give injection sclerotherapy in case of the hemorrhoids. And the current indication of proctoscope is anal pressure. We cannot do proctoscopy to a proctoscope in case of the anal pressure. This one is a Devers retractor, and these Devers retractor are of different sizes, and they are used to retract the intra-abdominal viscera during cholecystectomy, pelvic surgeries, retroperitoneal surgeries, liver surgery, and the laparotomy. This one is a Lingenbeck retractor, and it is a single hook retractor, and it is used to retract the layer of the intra-abdominal wall during appendicectomy and herniorrhaphy. This one is a suction with a guard, and it is used for the suctioning of the ascitic fluid and also for the suctioning of the blood from the incised area. This one is a tooth forceps because they consist of a tooth-like ends, and it is used for holding tough tissues like thick skins, epineurosis, fascia, and the tough connective tissue. And this one is a Russian forceps, and this Russian forceps is used for holding the mesoappendix. It is also used for dressing of the wound closure, and it is also used for the grasping of the dense tissues. This one is a plain forceps, and the plain forceps is used for holding the delicate structures like thin skin, peritoneum, vessels, and the bowel wall. This one is a mastoid retractor, and a mastoid retractor is used in mastoidectomy to retract and hold back the tissues during mastoid surgery. This one is a periosteal elevator, and it is used to separate and lift up the periosteum by assessing the underlying bone. This one is a curette, and the curette is used to clear the abscess cavity, and it is also used in the debridement of the necrotic bony tissue. This one is a bone nibbler, and the second one is the bone cutter. So the bone cutter is used to cut the smaller bones, and the bone nibbler is used to remove smaller pieces of bone during the laminectomy. These are the bulldog vascular clamps, and they are of different sizes, and they are used for the temporary occluding the blood vessels during the vascular surgeries, and they are also used during the organ transplantation to prevent the excessive bleeding, and they clamp the blood vessel. This one is a backcock forceps, and the backcock forceps are used to hold the sharp and delicate tubular structures like fallopian tube, ureter, and the appendix. This one is a Ellis tissue holding forceps, and these forceps consist of tooth-like structures at the end, and they are used to hold the tough tissues like epineurosis, fascia, and the connective tissues. This one is a Jordan forceps, and this Jordan forceps is used to remove stones from the common bile duct. This one is a honeymoon cholecystectomy forceps, and the honeymoon cholecystectomy forceps is used to ligate the cystic artery and the cystic duct during cholecystectomy. And these honeymoon cholecystectomy forceps are shorter angle, and they consist of transverse serrations on the inner surface. This one is a purgatory catheter, and it is used to remove the emboli from the blood vessel, and it is used in the case of the DVT, etc. And this one is a Cocker forceps, and the Cocker forceps has a tooth at the end, and it is used to hold the tough structures like fascia, epineurosis, etc. And they are also used to hold the strap muscles of the neck during the thyroidectomy. These are the intestinal clamps, and they are either crushing type or the non-crushing type. And these intestinal clamps are used to occlude the lumen of the intestine during the resection and anastomosis. The crushing type are applied to that part of the intestine that is to be resected, and the crushing type of intestinal clamp, they consist of the transverse lines, whereas the second one is the non-crushing type of intestinal clamp. So the non-crushing type is used to occlude the blood vessel and the lumen of the gut, and they are non-traumatic, and they consist of the longitudinal lines. This one is a chest tube along with a trocar, and the chest tube is used in the pneumothorax, hemothorax, post-thoracotomy, and it is also used in case of the chylothorax. And here the chest tube is inserted in the 5 to 6 intercostal space within the safety triangle, and the complications involve neurovascular injuries and bleeding. And this one is a straight artery forceps, and the second one is a curved artery forceps, and they consist of the transverse serrations. And these artery forceps are used to clamp the arteries. They are used for hemostasis to prevent the bleeding, and they are also used to crush base of the appendix during the appendicectomy. And these are the BP knife handle, and it is used to hold the surgical blade so that it can be used for the incision. This one is a towel clip, and it is used to fix the drapes in a manner that only the operating field is exposed to the atmosphere. These are the plain scissors and the curved scissors, and these scissors are used for the cutting of the tissues, and they are also used for the removal of the stitches. This one is a needle holding forceps, and the identification finding in the needle holding forceps is they consist of the crisscross serrations, and the needle holding forceps is used for holding up the needle during suturing, and it is also used for the holding of the tissues. This one is a laparoscopic port, and the laparoscopic trocar. So the trocar is used for penetrating the abdominal wall to enter the inside of the cavity, whereas the port stays in place to maintain the access of the instrument to inside of the abdominal cavity. So it is a laparoscopic port along with a trocar. This one is a Weir's needle, and the Weir's needle is used to create the pneumoperitoneum by inflating the abdomen with the carbon dioxide during various laparoscopic surgeries. And this one is a laparoscopic micro scissor, and this micro scissor is used for cutting up the tissue. It is also used to remove the adhesions. So it is used for adhenolysis, and it is also used to remove any pathological structure. This one is a laparoscopic microdissector, and it is used to separate or mobilize the tissue during the dissection, and it is also used in helping the blunt dissection without damaging the underlying structure. This one is a laparoscopic clip applicator, and it is used to apply the clip to occlude the structures like blood vessel and the duct, and it is used in the laparoscopic cholecystectomy to occlude the cystic duct and the cystic artery. And these clips are either of titanium or the absorbable clips. And the last one is a laparoscopic diathermy. And the laparoscopic diathermy is used for cutting up the tissues, and it is also used for the coagulation to control bleeding. So it was all about the common surgical instruments.